My name is Jordan Brackhouse, and I attend the University of Missouri. I am currently an intern for Missouri Rural Health Association and will be discussing the planning aspect in creating a telehealth program. Planning is the first step in establishing a new program, as we just learned why telehealth is so important in rural Missouri. An important quote once said, "A goal without a plan is just a wish." Planning allows for the community's specific needs to be understood and met. It also allows for the barriers to be acknowledged and to how to successfully work around them in order to get the most effective healthcare visit. Planning also endorses that all platforms are reliable, easy to access, and HIPAA compliant. There are benefits of planning seen in other healthcare settings, such as the ability to focus on priorities, to set expectations and timelines, to define roles and responsibilities, and have the ability to adapt to change. Here is the link to the CDC website where these benefits and much more can be found. In this video, we will be covering 5 key steps to planning your telehealth program. Your first step is to identify a need. The second is to form the team. Third, define success. Fourth, evaluate vendors. And your fifth and final step is to make the case. For more information, visit Telehealth Implementation Playbook found at the link on this slide. As you can see, planning is a very crucial step in establishing a new telehealth program. And I will now be going into more detail in regard to these 5 key steps. Step 1, identify the need. Telehealth can address many opportunities and barriers, but it is paramount that the technology must be rooted in organizational priorities, whether this be time management or even patient retention. You also need to brainstorm gaps and cares, thinking about where does the organization lose its efficacy. You also need to prioritize issues identified by frontline staff and determine which can most likely be addressed by telehealth. Within the identify the need step, a needs assessment survey must be conducted. This would be sent to community and healthcare staff. A needs assessment survey once showed that in 1998, roughly 2/3 of Oregon did not have a cardiologist serving the population. However, telehealth would be a successful solution for this area. You need to obtain feedback from staff, patients, and community members. You need to include mailed surveys, telephone surveys, and health department surveys. You need to keep in mind you're trying to reach every individual in your population. Questions would include things about transportation, internet, health literacy, employment, and family status. The results will show where priority focus needs to be. Step 2, forming the team. In forming the team, you need to identify core leadership and implementation teams, whether that be an office manager or a specific nurse or scheduler. You need to hold meetings with a new team to communicate responsibility, financial aspects, and IT. You need to continue meetings throughout the process, keeping up with the input from the staff. Also establishing checkpoints to have the team stay on schedule. It was found that 75% of employees rate teamwork and collaboration as very important. Step 3, defining success. In defining success, you need to evaluate your platform. Is your platform giving reliable data? Patients need to be able to trust your telehealth platform. After all, patients rely heavily on internet search engines to find out health information. You also need to think about, is your platform easily accessible? Can any age access our telehealth platform? You also need to keep in mind about wait room times, as times waiting for a provider have been an issue in the past for other telehealth program platforms. And lastly, you need to make sure that your platform ensures privacy. You need to be HIPAA compliant and have data encryption. Along with these, you need to identify 3 goals that are important for your whole organization, making sure they follow the acronym of SMART: specific, measurable, attainable, relevant, and timely. You also want to plan how you will evaluate your platform after implementation. Step 4, evaluating the vendor. In evaluating the vendor, you want to look for vendor validation. Is this vendor right for you? Is the program built for rural? Does it increase revenue for your hospital? Is it accessible? Is it affordable? If you have more questions in regard to vendor validation, you can reach out to Missouri Rural Health Association for more information. And your 5th and final step, making the case. Here, you want to define resources needed for successful implementation, whether that be funds, staff, or political support. You also want to estimate budget needs. Here, you'll also want to think about keeping your implementation aligned with organizational goals that were set in the defining success step. Your organization also needs to research coding and payment options, which will be discussed in a video later on in the series. Thank you for listening to the planning aspect of implementing a telehealth program and why it is so important. The next video will explain why the preparation aspect is a crucial aspect to a successful telehealth program. I hope you enjoyed the information provided, and feel free to reach out to Missouri Rural Health Association if you have any more questions. Thanks.